Okay, so today I'm interviewing Mrs. Marlen Trevino, who's a nurse practitioner at the clinic that I work at. Okay, the first question is just an introduction. Can you please introduce yourself and please include your name, title, education, work experience, etc.
Yes, my name is Marlen Trevino. I'm a family nurse practitioner, board certified. I graduated with my PhD in nursing in 2014. I have worked at Dr. Ruben Aleman and Associates for the past 23 years, where I initially started as a medical assistant and I transitioned into what I am now, a doctorate of nursing practice, nurse practitioner. I have worked here for the past 23 years, as well as I've worked for a rural clinic over in Elsa, in La Blanca, Texas. I've worked for the Border Patrol, and I also conduct HRAs, which are home risk assessments that I do for insurance companies at the patients' homes.
Cool. Okay, so this interview is basically trying to get information on how to build relationships with your patients and your, other healthcare professionals. So the first question regarding relationships with your patient is, how important is it to form a relationship with your patients?
Forming a relationship with the patient, I would say, is the most important aspect. Building trust, building respect is what is actually going to make that patient trust in you and want to come back and see you.
Okay, and what is the most important aspect that you think leads to a good relationship with your patients?
The trust and the respect. The trust, you build it as the actual patient comes in. She sees that you give her the proper care, treatment. She comes back, she feels good. And of course, always respecting that individual.
Next question would be, have you ever had a hard time forming a relationship with the patient? And if so, how did you succeed in doing so?
Yes. In 2008, when I graduated as a nurse practitioner, of course, patients here at the office were used to seeing me as a medical assistant and transitioning to a registered nurse. So when I would go into the room and I would ask and I would let them know that I was the one that was going to be treating them today, they seemed to be a little bit confused and they were a little bit hesitant for me to provide the care. It took me almost a year in order for me to build that trust with the patients. And all it took was educating them in regards to my level of education and what I was going to be doing for them.
Okay, next question would be, what advice would you give to future healthcare professionals on forming a relationship with their patients?
For other healthcare professionals in the same field as I would recommend for them to be respectful, for them to be patient. There are going to be some patients that are going to be a little bit hard on you and they're going to question, but be patient, and that trust will actually make you be successful in the relationship that you have with your patients.
Okay, so these next questions regarding relationships, professional relationships in the workplace. The first question would be, how important is it to form a professional relationship with those you work with?
It is very important depending on who you're forming the relationship with. Being that I was a medical assistant in the past, I've always told my medical assistants that work here at the office that they are the backbone of the office. They pretty much do everything for us as healthcare providers. So, of course, we need to have a very good relationship, open lines of communications with them in order for the patient to receive the care that is needed.
Next question would be, so as a nurse practitioner, how important is it to form a relationship with your supervising physician?
It is very, very, very important. Being a mid-level, especially a nurse practitioner, we have supervising physicians, of course, that need to be with us at all times. And our levels of education are very different. We are mid-levels, and even though we do get the actual basic foundation, we can't compare the level of education that an actual MD has. And forming a very good relationship with your supervising physician is what's going to make you be successful, and how successful you are in treating your patients. If you don't have that open line of communication with them, you're going to find yourself being a little bit hesitant to ask them, and of course that could affect the patient's outcomes.
So, forming a relationship with your subordinates, and in this case, it would be the medical assistants, seems to be crucial in any clinical or workplace environment. What advice would you give to future healthcare providers to succeed in doing so?
I would recommend for them to keep the relationship at a professional level, not form any friends, any kind of friendship. You have to be friendly to them because you all have something in common, which is taking care of that patient. But making them known that when you're in your 8 to 5 job, it is strictly professional, and outside of work, they can actually count on you as a friend or anything else.
Next question would be, when difficulties arise in the performance of your subordinates, and in this case it would be the medical assistants, how do you seek to achieve the improvements in their performance that you need?
When I see that my medical assistants are slacking off or they didn't do some things that were asked for them to do, I usually like to approach them in a group manner. Of course, you always start off by telling them how good of a job they're doing, and you give them the positives in regards to what they're doing right. But then you advise them on the areas of improvement that could actually be worked on. You always reinforce to them that patient safety is the number one. So just reinforcing to them how good of a job they do, and every once in a while meeting up with them, catching up with them, and seeing what they actually feel a little bit uncomfortable with and what we can actually work on.
So the next question would be, being a nurse practitioner, you do have to work with your supervising physician. So what advice would you provide towards gaining the most information from your supervising physician?
It's, once again, an open line of communication. I feel pretty comfortable in approaching Dr. Leman and advising him if I've tried everything in regards to the patient's care or it's something outside of my knowledge base. I feel very comfortable in letting him know, and he usually guides me. He bases it by his experience and letting me know and recommending what would be the best outcome or what we could actually do better for the outcome of the patient.
All right, and the final question would be, when work relationships create stress in your life, what advice would you give to future healthcare professionals in dealing with the stress?
Working in the medical field is going to be stressful, whether you're a nurse, whether you're a mid-level, or whether you're an MD. So you just need to learn how to differentiate, and the stress is always going to be there. You're going to be worried about your patients, especially because you have patients' lives in your hands. But is making sure that after the end of the day, you don't take your work home, that you take advantage of your family time and you just use things that time to relax and to do things that you enjoy.
Oh, all right. Thank you for providing all that useful information for future healthcare professionals.
Thank you.
Bye.